Hello everyone. In this video, I'm going to discuss about the questions and also try to give the answers of JENPAS PG for MPT 2020 entrance examination. This is the first part of the video, and here I will discuss the first 10 questions that came in the exam. Now, before starting, I want to mention some points about this exam. This exam paper will contain 100 questions, out of which 50 questions will come from general biological science, and the remaining 50 questions will come from the BPT course study itself. All questions will be MCQ type with 4 answers options. Time to complete the paper is 90 minutes and the medium will be English only. The total marks will be of 100 marks. Each correct answer will give you 1 mark and every wrong answer will yield minus 0.25 marks. So I hope you guys have an idea about the exam now. So I'm now going to the question part. Okay, so the first question is the reflex or reaction can be used to facilitate tone by lying a person prone or supine. So the stimulus given will be lying the person supine or prone, and the response is associated with the facilitation of tone, right? So we know that reflexes that are associated with tone are basically the brainstem reflexes, right? So in brainstem reflexes, there is ATNR, STNR, and TLR, right? So what ATNR says? In ATNR, the stimulus is a rotation of the head to one side, and the response we get is flexion of the skull limbs and extension of the jaw limbs. So this not the answer. The second option is STNR. Now in STNR, the stimulus is flexion or extension of the head, and the response we get is with head flexion, flexion of the upper extremities and extension of the lower extremities. And with head extension, there will be extension of upper extremities and flexion of lower extremities. So this again will not be our answer. Now the third option, TLR, that is tonic labyrinth reflex, the stimulus is prone or supine position. Okay, so now it is matching with the question, right? What the response we get is with prone position there will be increased flexor tone, that is facilitation of tone, right? And with supine, increased extension tone of all the limbs. So this satisfies the answer. So the correct answer is option C. The reference for this answer you will find in Physical Rehabilitation book, Susan B. O'Sullivan, 6th edition, page 177. Okay, so the second question is which of the following carpal bone is not found in proximal row? So for that we first know what are the carpal bones are. The carpal bones are scaphoid, lunate, diquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. To remember which bones are in proximal row and which bones are in distal, there is a mnemonic, right? Let's see that. Okay, the mnemonic is proximal row, that is she looks too pretty, and for distal row, try to catch her. Okay, now let's see this in the figure. Okay, now for proximal row, she scaphoid, looks lunate, 2 triquetrum, pretty pisiform. For distal row, try, trapezium, 2, trapezoid, catch, capitate, her, hamate. Okay, so the answer will be option A, that is capitate, because capitate is in distal room, right? Okay. Question number 3 is long handle reacher is used when the patients are having option A, limited joint range of motion of the shoulder and elbow, option B, weak grasp, option C, weak pinch, and option D, none. Now let's see what a long handled reacher actually is. Okay, a long handled reacher has a long handle which is useful for retrieving items when a person has limited reach and mobility. This is seen in conditions like in arthritis, in neural conditions like spinal cord injury. So here the answer will be option A, that is limited joint range of motion of the shoulder and elbow. The question number 4 is the ergonomics program include. Now before seeing the options, let's talk about what an ergonomic program is. An ergonomic program is a systemic process that communicates information to ensure that adequate and feasible solutions to ergonomic risks can be implemented to improve the workplace. It includes identification of high, moderate, low risk workstations, reporting procedures, workstation evaluations, training, and medical management. Now let's see what are the options. Option A, worksite analysis, correct. Option B, hazard prevention and control, correct. Option C, training and education, also correct. Option D, all of the above. So the answer is option D, that is all of the above. To know more about the ergonomics program, you can also check this article. Question number 5. Which condition would not be considered a contraindication for TENS? Now, TENS or transcutaneous electrical nerve stimulation is a simple, non-invasive analgesic technique which is basically used to reduce pain of any origin. It has many contraindications. Now, we see the options, right? The first option is placement over carotid sinus. Now, it is definitely a contraindication because if we place TENS over the anterior aspect of the neck over the carotid sinus, the stimulation may cause a fall in blood pressure, which we do not want, right? So it is definitely a contraindication. Now let's see what option B is. Option B, used during labor and delivery. We will come to the option later. Let's check what option C says. Okay, option C says patient with cardiac pacemaker. Now this is a bit trickier option because if we see the study by Erickson et al. 1978, they said TENS can interfere with cardiac pacemakers of the synchronous type, but it is safe to use TENS with asynchronous fixed rate type pacemakers. Now, this type of pacemakers are rarely used today. So, patient with cardiac pacemaker is definitely not the option because it is a contraindication for TENS. Now, let's see what option D is. Option D is placement over pregnant uterus. We do not place TENS over the pregnant uterus because it is a contraindication of TENS. Now, we see that option A, option C and option D are contraindication for TENS. So it leaves option B. Now why option B? Used during labor and delivery. Because if we apply TENS towards the end of pregnancy at the time of labor, it basically induces a painless delivery, right? So we can use TENS during labor and delivery. So the correct option is option B, that is used during labor and delivery. To know more details about the contraindication to the use of TENS, you can follow the Electrotherapy Simplified book by Bikananda, second edition, page 186. Question 6. Baker's cyst is. Now, Baker's cyst or popliteal cyst is the bulging of posterior capsule and synovial herniation that produces a soiling in the popliteal fossa. So this is the synovial cavity, and if this herniates, in a posterior direction, that will be called a popliteal cyst or Baker's cyst. Now let's see what the options are. The first option is prepatellar bursitis. So we all know prepatellar bursitis is basically or commonly known as housemaid's knee. It is the swelling to the front of the patella, not the back. So this could not be the option. Now option B, infrapatellar bursitis or clergyman's knee. This swelling is below the patella, superficial to patellar ligament. So the swelling is here again anteriorly, not posteriorly. So this also could not be the answer. Now option C, yes, synovial cavity extension. So this actually applies to the answer because the synovial cavity here is extended posteriorly, right, towards the popliteal fossa. So this will be the answer. Now let's see what the option D is. Option D is suprapatellar bursitis, which again not be the answer. So our answer is option C, synovial cavity extension. To know more about this topic, you can follow the Apley and Solomon System of Orthopedics and Trauma, 10th edition, page 602. Question 7. Absence of which of the following predicts poor recovery of motor control? Okay, so we know that to get a good motor control, the sensory input should be well enough. Now suppose you are standing, right? Now you imagine that the proprioception, light touch sensation and pain sensation are not intact. So now suppose any input stimuli is given. Now that stimuli does not reach to your brain. And what happens? The brain is not able to process that stimuli. So the motor outcome will be localized or haphazard because the brain does not take any part in controlling that stimuli, right? So now let's see what the options are. Okay, now among these four options, option C, that is localization of light touch, temperature or proprioception, fits the question properly. So the answer is option C, that is localization of light touch, temperature and proprioception. You can also see this article to get a better understanding about the motor recovery. Question number 8. If active range of motion is less than passive range of motion, then there is a problem of. Okay, so first, what is active range of motion? Right, so active range of motion is the arc of motion attained by the subject during any unassisted voluntary joint motion. So here the subject performs the range of motion, by himself. by his willingness to move, coordination, muscle strength, and joint range of motion. So it basically associated with the contractile tissues such as muscles, tendons, and their attachments to bone. So any problem or decreased range of motion in active movement is basically due to involvement of all these inert tissues, whereas passive range of motion is the arc of motion attained by examiner without assistance from the subject. So in case of passive range of motion, basically patient does nothing and the therapist actually doing the range of motion, right? So active range of motion will be less than passive range of motion when there will be muscle weakness, because the patient cannot perform the active range of motion. But when the therapist are performing the movement, the range of motion will be greater because there were no active involvement from the patient. So let's see the options now. Now, among these four options, option D, that is muscle weakness, correctly fits for the answer. So the answer is option D, that is muscle weakness. To know more about this, you can follow the Measurement of Joint Motion by Cynthia C. Norkin, 4th edition, page number 8. Question number 9. What reflex is developmentally appropriate until 5 months, vital for newborns, and can be seen when the corner of the infant's mouth is stroked? Now, here the stimulus is that the corner of the infant mouth is stroked, and response we get is turning of the head of the child in the direction of stimulus, as appearing that the child is sucking the object. Now this specific reflex is called as sucking reflex. It is very vital for newborns because they need to feed from mother's breast, right? So this reflex is basically keeping the baby alive. This reflex also integrates within 3 to 6 months. So the answer is sucking reflex. Now let's see what the options are. Okay, among these four options, option A is sucking reflex. So the answer will be option A, sucking reflex. For more details, you can check the Gladys Samuel Raj book. Question number 10. Inability to insert a key in door due to tremor is an example of. Okay, so first, what is tremor? Right? Tremor is basically an uncoordinated movement. You know, there is dysmetria, dyssynergia, dysdiadochokinesia, and basically due to the involvement of cerebellum and cerebellar tracts, right? So here the question asking inability to insert a key in the door, that is tremor occurs during the activity, not when the patient is initiating the movement or not at rest. So what could be the answer? The answer is actually intention tremor, because in intention tremor the tremors are involuntary, rhythmic, and shaking that occur when purposeful movement is attempted and results from inability of cerebellum to dampen motor movements. Right? So now let's see what the options are. Option A, intention tremor. Okay, now we know the option A will be the answer. Now let's see what other options are. Option B, okay, postural tremor. Now what is postural tremor? See, postural tremor basically is when the patient is sitting or standing, when the limb or the body is supported against gravity. What the patient does is actually they typically present with this sort of tremor, that is shaking back and forth oscillatory movements. So this is not the answer. Option C, resting tremor. That is, the tremor occurs when the patient is at rest. Option D, none of the above. Okay, so we already know the answer, and it is option A, that is intention tremor. To know more details, you can follow the rehabilitation book by Susan O'Sullivan, page 667.